Arguably one of the best attended scientific symposia was the one titled Pathologic, Heterogeneity of Alzheimer's Disease. The questions that we actually asked of the four presenters to delve into had to do with not only the comorbidities that frequently coexist with Alzheimer's disease of late onset, but also the very interesting concept of disease heterogeneity in the early onset group. And we had a terrific lineup of speakers that honed in on these very questions. What was really important, as mentioned by most of the speakers, is the fact that we need to better characterize co-pathologies in those with late onset. For instance, we recently started focusing on TDP-43, a very commonly seen co-pathology in those with late onset. We recently understood better and defined better a condition known as primary age-related tauopathy, which actually is seen in quite a high percentage of amyloid negative patients that present just like Alzheimer's disease in late life. Further, they characterized also the early onset group, a group that can be affected in their 40s and 50s, even without, in the absence of a genetic mutation, the so-called early onset sporadic Alzheimer's disease. And the speakers focused on how heterogeneous these patients are and how important it actually is to clarify the pathology in those individuals, that they're amyloid positive, that they have aggressive disease with a lot of tau deposition in the cortex. Because what we know from previous literature is that these patients tend to progress really fast. And they're in a productive age when they're still gainfully employed. They're still raising children and sending them to college. It's a very important part of where we need to take science as our next step.